Do you know that there's actually more than one type of healthcare privatization? Well, let's talk about it. Hi guys, thanks for clicking on this video. I'm Nikhil, a third-year graduate entry medical student studying at the University of Southampton. This channel's all about medicine, productivity, lifestyle, and self-improvement. So if this sounds a bit like you, subscribe and hit that notification bell icon while you're there. And also follow me on my Instagram if you want quick answers to any burning questions that you guys might have regarding pretty much anything. So should be somewhere around here. Now, to the topic in question. I actually got asked this question in one of my interviews and I slightly panicked. I did mentally prepare for it, but I failed to structure my response as well as I would have liked. It felt like trying to reach this unknown destination, but without a map. And I just kept rambling on and on without actually reaching a conclusion and giving my actual opinion, which is, I'd argue, the most important thing when answering questions such as this. So it basically felt like I was just trying to hit that word count for an essay that's due in an hour, or 2 minutes in this case. Now, thinking back retrospectively, this is a video that I wish existed a few years ago. I'll be talking about how there's actually more than one type of privatization, a very brief history of the NHS because I don't want to bore you guys to death, and there's 3 main core principles, the pros and cons of privatization, and how you should actually go about picking what side of the fence that you decide to stand on when giving your final thoughts. Something which I promise you will really impress at the interviews. This, like I previously mentioned just now, is also something I regrettably did not get to do when I was answering this question. Also, stick around till the end where I'll be sharing the golden structure you guys need to stick to when answering any debatable questions such as this one. I'll also leave timestamps in the description and somewhere on the screen, so feel free to jump around. Alright, let's just crack on. It's always a good idea to start with a bit of background and make sure you understand the terms and concepts within this question. In this case, it's privatization. In textbooks, you'll often find a definition along the lines of the transfer of a business, industry, or service from public to private ownership and control. Next, it's important to consider the differences between the 2 main types of privatization that exist. The first type of privatization is one where patients have to pay for healthcare, either directly straight from their pockets or through a private health insurance. This is seen in the US. While in the US there is a basic level of care for those unable to afford it, the majority of the population has to pay for their own healthcare. This ultimately leads to this two-tier system or two-tier health system in which those with higher income are basically able to access better healthcare. This also happens in the UK, but to a much lesser extent. In fact, last summer I had to go through my private health insurance company to basically get an ACL reconstruction done. This was mainly because the waiting lists on the NHS for the surgery was just super long, and because at the time, last summer, most if not all of the elective surgeries were put on the back burner because of our favourite virus. Now, the second type of privatization is one in which healthcare remains public, but services are outsourced to private firms. So that basically means to the patient, care is still free at point of access. In fact, this is a type of privatization that's also being used within the NHS. One such example is paying private hospitals to carry out certain operations, thus reducing the NHS waiting times. But most importantly, the burden placed on its already tiring shoulders. Basically, just to summarize, in this type of privatization, the private companies are being paid by the NHS and hence the government, and not directly by the patient themselves. Now here's a top tip. Always remember to make the distinction between these 2 types of privatization, and also clarify which one you're going to be discussing when you've actually come to the stage where you're weighing both the pros and cons of privatizing the NHS. For the sake of the rest of this video, we'll be talking mostly about the first type of privatization, as you know, it's more barn-door for what we usually perceive or define privatization to be. Here's a very, like I promised, very brief history of the NHS. It was basically founded in 1948 by the health minister at the time, Aneurin Bevan. The idea behind the NHS relied on three core principles, and it's important that you know what these are. The first one is that it meets the needs of everyone. The second is that it be free at the point of contact or the point of delivery. And the third is that it be based on clinical needs rather than one's ability to pay. Having discussed the two types of privatization that exist, we can clearly see that the first one is completely incompatible with the core principle that I've just mentioned. So that's something you could say if you're answering against privatization. However, if you're arguing for privatization, you can completely flip it around and say something like, this could be argued that these core principles are extremely outdated because they were created more than 70 years ago, and society's needs today have drastically changed, and this potentially calls for a big re-update of the core principles. I hope that makes sense. When you actually get to discussing the pros and cons, it is important to keep your answer structured. A good way to do this is try to consider the different perspectives of all the parties involved in this topic. So you've got the patients, you've got the doctors, you've got the government, and also you've got the private company themselves. And then discuss the pros and cons for each of them separately. But there is a way to do that, and I'll get to that at the end of the video. Now, if you want to talk about the pros, one of the main drivers for the idea of privatization is the idea that the current free-for-all healthcare model is failing because of financial pressures on the NHS. It is widely believed that this will not be sustainable in the long term, as in the last several decades, life expectancy has rapidly shot up, which, you know, if you couple that with current advancements in technology, it makes medicine and care so much more expensive than it was before. Now, another argument for privatization is that using private providers of healthcare services will introduce this healthy competition, which in turn will drive down costs of investigations and treatment. It's kind of like an auction, but in reverse, if that makes any sense. So the cheapest bidder is the one that wins. Now, from the patient's point of view, which is arguably the most important factor, because, you know, we're all about the patients, if the second type of privatization remains, so that's type 2, this will actually not have a negative impact or negative financial impact on the patients themselves directly, as healthcare at the point of delivery will largely remain free. Patients might not even be aware that they're being treated by private companies. In fact, distributing services to private companies could mean reduced waiting times, which would benefit the patient massively, as it would lead to faster access to treatment, and that means it can lead to a longer time for recovery, and this ultimately leads to a dramatic increase in the quality of life, which is the ultimate goal for any healthcare professional. Now, lastly, concerns are often raised about poor working conditions for healthcare professionals, leading to overworking and burnout. And I'm sure you've all heard about that when you're trying to find out more about working within the NHS. Now, introducing privatization can help with this, because the shorter the waiting lists on the NHS, the less of the demand and the strain that's put on the members of a multidisciplinary team or an MDT. Now, you can also bring this back full circle to the patients, because if waiting lists are reduced, a doctor or nurse can give more of their time to each patient, and this can improve the overall quality of care given. Now, for the cons, many doctors have expressed their worry over increasing the amount of privatization. And in fact, more than 2/3 of those surveyed by the BMA, or the British Medical Association, claimed that 2/3 of people or doctors were uncomfortable with the private sector providing their NHS services. This is mainly because of concerns that private healthcare provision has this potential to destabilize NHS services. Now, if that doesn't make sense, let me explain. If NHS service providers are continuously outbid for their services, they may become financially unviable and will eventually disappear. And this can lead to private companies having total monopolies over care services. It makes sense because without competition from the NHS, private companies may choose to set their prices well above the actual true cost of care, just to maximize their profits. This is a concern for many, as it may lead to the death of the free NHS and the birth of an insurance system like the one we see in the US. Now, in the short term, there are also concerns that if private providers are motivated solely by profits, they may be less likely to provide effective and safe care, and they actually may cut corners when it comes to patient safety, just in order to reduce their costs. Now, another point could be if a particular service is not financially beneficial for the private company, they may choose to completely abandon it, potentially leaving patients without access to life-saving medical treatment for both physical and mental health problems. And this will basically mean that the patients will be put back onto the NHS waiting lists, which in turn adds even more pressure on NHS services. Now, talking about the patient's point of view, a potential disadvantage of privatisation of healthcare are the unnecessary investigations and over-treatment just for the sake of profit gain. Many medical investigations can be harmful to patients if not used carefully or if overused, like for example CT scans or X-rays because of their radiation levels. So if private companies are being paid per investigation or for the treatment that they give, they may be tempted to deliver these even when it's not in the patient's best interest. Remember that in an interview scenario, if this helps, someone told me this and it really made me feel a lot more confident when approaching questions like these. But remember that there is no right or wrong answer. The medical course is designed in a way that you would often be expected to have an opinion on a controversial topic and be able to weigh all possible arguments for and against before you make this judgment call and actually stick to it. Whatever you do though, don't sit on the fence, and once you actually do pick a side, stick with it and defend it with the arguments in favour with confidence. That's key. Fake it till you make it. It doesn't always apply, but it definitely applies in this case because you have 5 to 7 minutes just to impress the person and move on. Now, here's the golden structure. So this is what I deem a fail-proof structure for answering any question that has two sides. But I'm going to use privatisation as an example. So first, you want to briefly introduce the topic. For example, in this case, we talked about how there's two types of privatisation, and we also talked about the NHS's 3 core principles. And then, depending on the stance you take, you first mention the points that argue against it. I know it may seem a bit counterintuitive, but it's going to make sense. So let me just explain this with an example. So suppose if you're arguing against privatisation, first talk about the pros of privatisation. And this mainly helps to set up the scene for your opinion later. Then you want to mention the arguments that support your stance. So the cons in this case, but you want to set them up in a way by saying something like, despite the aforementioned points in favor of privatisation, I believe that it should largely remain free for all. This is because, and then you could just list out all the cons of privatisation we just talked about. I hope that makes sense. That's because you want to end the answer with your opinion, because it's just going to have the strongest impact just naturally. So yeah, that's the end. That's it for the video, guys. If you found it useful, please drop a like, and if you want more content like this in the future, hit those subscribe and bell buttons. Wait, do you call it bell buttons or is it notification icon? Anyway, and good luck to all of those who are still going through the weird online interview process. All right, in a bit.